Hi, everyone. I'm Ashley Bassett,
And I'm Catherine Logan.
and welcome to another episode of the Injury Report. Today, we're breaking down a common but sometimes career-altering knee injury in professional football, and that's the meniscus tear. We'll cover how often these happen in the NFL, how players typically present, what treatment choices look like, timelines for returning to play, and critically, how meniscal injury affects performance and career length. For many of us, being active isn't just about sport. It's about living fully. But when knee pain or ankle instability gets in the way, it can feel like your body is holding you back.
That's where push braces make a difference. The PushMed ankle brace AcquiFlex and the Push Sports knee brace provide the stability you need without locking you down. Sleek, comfortable, and crafted in Europe, they're built to move with you, whether that means training hard, going for a run, or simply staying strong and confident day to day.
With innovative designs that support while allowing natural movement, push braces help athletes and active people alike find relief, prevent pain, and stick with their treatment so they can keep momentum in their lives.
See the difference at bracelab.com. Clinicians can email samples at bracelab.com and mention the sports docs for a free sample.
JRF Ortho has some exciting news. Starting early in 2026, JRF Ortho is launching a quarterly traveling fellowship program designed to provide you with hands-on exposure to osteochondral allografts, meniscus, and ligament repair, all in a dynamic and stimulating hands-on environment.
Each fellowship will be led by distinguished faculty with opportunities to learn in different regions across the U.S. Fellows will also get an exclusive behind-the-scenes look at tissue processing with tours at JRF Ortho's partner facilities in Denver.
Every quarter, 3 outstanding candidates will be selected for this unique experience. The first fellowship takes place in Southern California in early February, featuring Doctors Bugby, Mandelbaum, Merzian, Dean Wang, and Tim Wang. This will be followed by a second opportunity in April.
In late summer, early fall, JRF Ortho will feature 2 exciting options. One will be dedicated entirely to an all-female cohort, with both faculty and fellows coming together to advance women in orthopedic surgery. The other is open to any established orthopedic surgeon looking to explore their knowledge further in allograft transplantation.
Applications are currently open for each of the different options at jrfortho.org or reach out to marketing at jrfortho.org. Elevate your technique. Expand your network. Lead the future of cartilage restoration by applying today.
All right, let's do a refresher. So the menisci are 2 C-shaped fibrocartilage discs in each knee. So there's a medial and a lateral that help distribute load, absorb shock, and stabilize the joint. Losing meniscal tissue through a tear or if you have a meniscectomy, that changes knee biomechanics and increases contact stresses on articular cartilage. This can lead to earlier degenerative changes. This biomechanical role is why meniscus management matters so much for athletes.
So, how common are meniscus tears in the NFL or NFL prospects? Well, that depends on what study you read and how that study chose to measure the prevalence of meniscus tears. So, older studies relied predominantly on self reported history. So, yeah, I had a meniscus tear at some point. I had a meniscus surgery at some point. That found a prevalence of about 12%. However, a newer study published by Dr. Jorge Chala, friend of the show, in 2018 in AJSM, used MR imaging data to determine the prevalence of prior meniscal injury. This study looked at approximately 2,000 NFL scouting combine participants from 2009 to 2015, and they found that 20% of players had a prior meniscus injury. So this is much more frequent than the previous 12% that we thought. This study also went on to discuss the impact of partial meniscectomy on player performance and career length, but more on that later.
All right, so now let's talk about how meniscus tear typically presents. So presentation ranges from acute mechanical pain with a twisting contact event, so like locking, catching, or a fusion. And then it can also range to an insidious medial or lateral knee pain with swelling and reduced performance. So lateral meniscus tears are often linked to contact and valgus or rotational forces, whereas medial tears are frequently associated with more chronic degeneration or combined ligament injury. MRI is the diagnostic tool of choice and pretty standard in elite athletes, often supplemented by the clinical exam. So we look for joint line tenderness, where the meniscus lives, as well as an exam finding called the McMurray.
All right, so moving on to treatment, there are three main options: non surgical treatment, partial meniscectomy, and meniscus repair. So let's just discuss each of those. So, non operative management includes bracing, physical therapy, and injections in select degenerative or stable tears or symptoms that are tolerable and performance is not affected. Arthroscopic partial meniscectomy can be performed to remove the torn meniscal fragment. Advantages of this approach include faster rehab and quicker initial return to play. Disadvantages include loss of meniscal tissue, which can increase the long term risk of osteoarthritis and may also affect durability.
So, meniscus repair, on the other hand, aims to preserve that meniscal tissue. There are various repair techniques, including inside out, outside in, all inside, or root repair. And this all is dependent on where the tear actually is and how we can access it. And the advantages of repair include preservation of meniscal function and reduction of that long term osteoarthritis risk. But the disadvantages that come with meniscus repair is a longer rehab and a higher short term failure risk in certain tear patterns.
Yeah, so ultimately, the choice of treatment depends on tear pattern, as Catherine was alluding to. So, where is that tear and is it repairable? Leg alignment and concomitant injuries such as an ACL tear. Player position, season timing, and the player's long term goals obviously also contribute to decision making. And coexisting injuries, especially ACL tears, often change strategy. So, surgeons commonly repair meniscus tears when possible in the setting of an ACL reconstruction because healing rates are higher with the biologic environment created during the ACL surgery. And also, they're going to be out of sports for a lot longer anyway, so they can kind of swallow that 4 to 6 month recovery a little easier than if it's an isolated meniscus repair.
For sure. So let's get, what we all want to know, on the table. So we all want to talk about return to play. So teams and fans just want to know if a player stands a good chance of coming back. And if so, when are they going to come back? So first, let's talk about the rate of return to play. So systematic reviews of elite athletes reported pooled return to play rates after if they just had an isolated meniscus surgery around 80%. So that range depends on the series and sport. But time to return and performance after return varies by sport and treatment.
As for timeline to return, that varies by procedure, as we kind of alluded to earlier. After partial meniscectomy, many athletes can return in a few weeks to a few months. Published consensus guidelines often quote a typical return to play window of around 4 to 12 weeks, depending on position and symptoms. The rehab after meniscus repair is much longer to protect that healing and typically is 6 to 9 months before unrestricted contact play is recommended in most consensus statements. But the exact timing really depends on tear type and surgeon preference.
So now let's talk about performance after meniscus surgery. So unfortunately, prior meniscectomy or removal of meniscus tissue is associated with worse career performance metrics and shorter careers in several NFL combine cohort analyses. Two papers are worth mentioning here because they give us concrete data. So the first is a case control series of NFL athletes, and that was authored by Dr. Robert Brophy. So this study found that players that underwent an isolated meniscectomy had shorter careers, and that was a loss of 1.4 years on average, and played 23 fewer games than their matched controls.
Yeah, so pretty significant. The second
Pretty
paper
big
that
deal.
is the one that the second paper is the one that we mentioned at the start of the episode, and that was an imaging performance study authored by Dr. Jorge Chala. And as we mentioned, this study looked at a little over 2,000 NFL combine athletes and reported that 12.6% had a history of prior meniscectomy. The authors found that players with greater than 10% meniscal excision had significantly fewer games played, fewer games started, and lower snap percentages during the first two NFL seasons after controlling for position. They also found a strong association between the amount of meniscus tissue loss, worse cartilage lesions, and poorer early career performance.
Yeah, and actually, I can't remember what the average length of an NFL career is anyway. Do you know?
I think the 7
It's
jumps out to me. I think it's like 7 or 8.
yeah,
So a loss of a year, almost like a year and a half, is pretty substantial.
pretty big deal.
Yeah.
So to summarize, many players do return and perform, but meniscectomy is associated with increased risk of cartilage degeneration and in some studies, reduced career length and games played. So meniscal repair aims to avoid that late risk at the cost of a longer rehab and a possible delay in return to play. And teams have to balance that short-term availability against potential long-term joint health when choosing repair versus resection.
Also, in-season decisions differ. So if a I'm still thinking clinic. If a player is needed now, such as playoffs, right? Like a meniscectomy can get them back faster. If it's off-season or repairable tear, teams increasingly are leaning towards repair to preserve long-term function. So shared decision-making with the player about their short-term versus long-term goals and the team's short-term versus long-term goals is really critical.
Yeah, it's tricky because I feel like it's so easy to just focus on the short term, and think, I just got to get back. I just got to get back. And the team's thinking that way, the athletes thinking that way.
Mhm.
But obviously, just like anything, that repair, it's short term pain and longer rehab, but it's the right decision for sure.
Yeah, absolutely. And I feel like once you have that data showing the alteration of career length and the games played and the snap percentage and the performance metrics, it might actually make players more likely to consider that repair. Because previously it was like, just cut it out and let me get back there. I want to be back in 6 weeks. But it's like, if it's going to hold you back from having a full career, I think that would really make people think twice.
Yeah, I
Yeah.
hope so. Hope so. It's
Yeah.
hard when you're like that bubble player, you just want to do what you got to do.
Yeah.
Yeah, great
Yeah.
paper though. I'm glad you brought this to our attention.
Yeah. Well, thank you everyone for listening to this episode of the Injury Report. We hope you enjoyed our conversation today. Make sure to subscribe on Apple Podcasts, Spotify, Amazon Music, pretty much anywhere you get your podcasts. You can also watch us on YouTube as well. If you like what you hear, please consider leaving us a review or comment. You can also reach us by email at thesportstalkspod@gmail.com or find us on Instagram at thesportstalkspod. We love your feedback.